Hi. Thank you so much for all of your notes, messages, everything about the first video that I shared on what I was calling a tumor and LAMN. And this is part two. I want to update you on what's going on with me since I told you about that surprise tumor that was discovered in what was supposed to be a routine endometriosis removal surgery. And I wanted to wait until I had a completely conclusive update and concrete diagnosis, but unfortunately, that's going to take a couple more weeks. And as I'm learning, this just keeps evolving. So it's just going to keep getting more long and long and long. And while I'm in this limbo, I just want to use the opportunity, what's also been going on in the background. So first, I want to share some things that I've learned that I was incorrect about in my research for the LAMN in my first update and video, or that I can at least explain better. And then I'll go into everything that I've done, all the doctor's appointments, all the feelings that I have, and all of that. So um, the best way for me to describe LAMN, which stands for, if you missed everything, low-grade appendiceal mucinous neoplasm, and apparently I've been saying it incorrectly too. It's LAMN. That's what the doctors say. You don't just say it as a like a you don't just say the letters. You say it like out loud, like an acronym. It's just you just say pronounce it LAMN, which to me seems silly, but so what LAMN is there's a bunch of jelly, like it's a jelly-like substance that fills up in your appendix. That's where it starts. And your appendix is supposed to be the size of like a finger, like an index finger. And mine was ginormous. If you want to see the picture, you can message me, I guess. I don't want to put it up here because I think body parts are gross. I've had an extremely short exposure period in this less than a month to this, and I'm somehow just like starting to get okay with all of it. But okay, so the appendix, LAMN starts in your appendix. It only starts there. And you have all of this jelly that starts growing inside of your appendix. And basically my appendix like went from a finger and it ballooned up and reached the maximum capacity that it could stretch to. And it kind of started to leak through the tissue of the appendix. So some of this jelly stuff was present on top of the appendix, which is not good. So apparently tumors are graded or rated kind of like earthquakes. It's like T1, T2, T3, T4. And T1 is the best case scenario and T4 is the worst case scenario. And mine was T4, bad. So it's also helpful for you to understand in this particular case that I was imagining when they told me that I had a tumor, it was like a traditional kind of tumor. I was thinking that it was like something growing on top of my appendix. And that's not what happened. There was no hard additional thing on top of my appendix. Basically, my appendix was the tumor. The jelly-like substance inside of my appendix was the tumor. And it had kind of infiltrated my organ and it had taken over so far that it didn't have any more room. So it was kind of leaking out. And that's why it was labeled T4. So the second thing was that I originally thought in the first video that I thought the colonoscopy was going to be the main procedure that I would get that would determine the severity of my diagnosis and the course of my treatment, and that was not true. The colonoscopy is simply part of what doctors are calling like a workup that is to determine if I have additional tumors or abnormalities in my colon or intestines. I haven't gotten that yet. It's had to be rescheduled multiple times with conflicting scheduling issues. It's basically just due diligence based on the region that the appendix is part of where it's located in my body. And the third thing that I didn't know, and when I recorded that video that we're going to get into today, is that it's possible that it's not LAMN, it might be something worse. So now I'm going to tell you about that and everything that I've learned from the doctors and specialists and the emotional ride that came with it. The overarching theme of this is that what I'm experiencing is incredibly rare. The odds of having a tumor on or in your appendix and that thing being LAMN is a 1 in at 1 in 33 billion shot. So it's more rare than being bit by a shark, than being in a plane crash, than being struck by lightning, than dying by a snake bite, than being attacked by a bear, or being hit by an asteroid. So basically, the doctors don't have this information available in their heads like they do for like a sore throat, right? And I understand why. It would be irresponsible to waste their brain space with a rare disease about a vestigial organ. Unfortunately for me, that means that everyone that I'm going to is having to study up before they meet with me. They're going off literature and applying what they do know about other practices to how to move forward best and how to treat me. And it's very humbling to realize that we're all just in this together and to remember that adults, even in specialties, even doctors, we're all just working through this the best that we can. Okay, so the first thing that I did after I got that diagnosis when I made that video was go up for my post-op with my appendectomy surgeon. So I sit in the waiting room and I watched 6 people go in and out of his office and be seen like in a 20-minute span. I knew he was a surgeon and there are all sorts of reasons to go up for a post-op or an appointment with a surgeon, but I just did not like the vibe and how fast people were being seen. And I was afraid that and worried that he was going to spend that short of amount of the time with me. And I had so many questions. I was worried that I was going to have to advocate and be like kind of mean to get my time. But he didn't do that with me. So I don't know what those people were going in for, but yeah, it was my first appointment and I was scared. But he talked to me. He knew about what he know about. Bleh. He talked about what he knew. He talked about what he thought. He talked about what he didn't know. And I have to say that with everyone that I have talked to, I do really appreciate their honesty about what they don't know. I really love that about science, that when they can just say, we do not know. I like that no one has been bullshitting me when they talk about what they do know. There has been steps in this when people omit things because they don't want to scare me, and I learn them anyway. But I do appreciate that when I ask a direct question, I'm answered. And if the answer is I don't know, the answer is I don't know. So during this appointment with the appendectomy surgeon, that's when I learned about the T4 level of the tumor, and that scared me. He also told me that no matter what happened, due to the fact that the tumor was diagnosed as T4, that I would absolutely need a bowel resection surgery. So that's kind of like where they remove the top of the intestine where your appendix was, and they kind of like chop off some stuff and they reconnect it because your intestine's really long and they just kind of like those are the medical terms. And then he told me that pretty much everything else from here on out was going to need to be made by an oncologist, and that was going to be kind of like my mentor. And I was out of his hands now. That's been something that a lot of people have said to me. They're like, and now you're out of my hands. Kind of a relief for them. But he also told me that he was really interested in this and he cared about me and that he was going to bring me up as a case study at an upcoming conference due to the rarity of my situation, and that he was going to advocate for me to find treatment with 2 oncology surgeons that have access to HIPEC. And if you watch the first video, you know that HIPEC is like the kind of chemotherapy that would come if I needed it with LAMN. So you don't, because it doesn't spread through the lymph nodes, it only stays in the abdomen. So you need a different kind of chemo. So it doesn't make sense to start working with an oncology surgeon that doesn't have access to that. And there's only like 3 places in the area that have it. Okay, so then I leave his place and then he tells me that my next step was to go to an oncologist, and he ended up recommending one that coincidentally treated my grandma for a blood disorder like decades ago when she was still alive, and that I should find an oncologist at one of the 3 centers who have HIPEC, and that's the chemo thing. And I left that appointment feeling sad and scared. I saw the picture of my appendix for the first time. It is so weird. It looks like a naked mole rat. It's so gross. And I understood the nuances of LAMN better. I was told that I would definitely need another surgery no matter what, and that I was about to go to oncology. I felt scared. And like there was worse information that I had before than based on my research before. So the next big thing was that I went to the oncologist. And the oncologist, the first thing that he asked me was, How anxious was I in terms of taking this into my control? And would it be okay with me, hypothetically, if I did nothing? Um, and I was like, what does that mean? And the basis for that question came from the reasoning that if the diagnosis is LAMN, the best course of treatment is actually to get monitored every year or twice a year with a CAT scan and blood work to test for the jelly in your belly. By the way, this very rare condition has a nickname, like a street name of jelly belly. You can look it up. Have you ever heard of a cancer having a street name? Because I have not. And if there was one to have a nickname, wouldn't it make sense for it to be like a popular one, like breast cancer or prostate cancer to have a nickname? I don't know. Life is weird. Anyway, of course, I have one that has a street name, and that's Jelly Belly. So the oncologist tells me that if we can verify that I have LAMN, all we need to do is sit back and monitor me, albeit that is something that I'll have to do for the rest of my life, like go to these CAT scans every single time, like at least every year. But that's great news to me because I was worried about the PMP and like the whole thing of like, do I have this thing that could like kill me like 5 to 10 years? Like I was really worried about that. And I'm like, I will take it. I ask him what would happen hypothetically if during one of these routine CAT scans, if they do find the jelly, and he says they would just do a surgery to manually remove it. And if it was somehow to hypothetically escalate in a freak scenario, that they would do the HIPEC, that unique chemotherapy that flushes out your abdomen. But due to the routine scans, I would usually never be at risk for like ever moving from stage 1 to stage 4 or something like that. I would be very safe. And he tells me that later that day, he is going to a GI conference and he is bringing up my case so that they can study me and collaborate on a treatment plan. Because the truth is, again, no one is sure about what to do. So he's going to call me later today when they have finished their conference with more information. I left that office feeling so high on life. When I got, and I had to circle back out to leave, and I'm in the oncology waiting room and I see it through different eyes. When I was coming in there, I didn't really look around that much. I was so determined in my rainbow outfit and this hat and my trapper keeper, focusing on the forms and having my questions in order and leaving this with this new information that I might not have to do any treatment and just monitor myself for my health. Like I felt like I had a new lease on life. And these sliding doors opened automatically to open up into the skywalk that connected to the parking garage that my car was in. And I was just stopping in the middle of the skywalk, and I stopped and I sent voice messages to Matt and Katie and Janice. And I just felt this relief. And I'm getting lightheaded just thinking about it. Like I listened to the song If Work Permits by the Format on repeat as I drove to my dad's work, and I told him in person that I might be okay. And I really hope that that's the truth. So later that day, I get a call from the oncologist after his conference. He told me that the conference concluded and that I needed to meet with a specialty surgical oncologist to verify that it is LAMN, and that from there we would move forward with what he talked about if it's LAMN. And I'm like, sounds great, right? But I didn't consider that by confirming that it was LAMN, that there was another option that they weren't telling me. Confirming that it's LAMN means that it might not be. See, there's where I'm talking about omission, right? So I get to the specialty surgical oncologist. She is located inside of a very high-tech hospital in a specialty oncology unit and wing that has its own name. I get lost trying to find it. It's like an airport in there. There's a great cookie in there. I was like, why does a hospital smell like chocolate? Very strange. I get in there, I get checked in with a bracelet just to go to an appointment like you would at an emergency room. It's very strange, very high tech. I get back to the room. We discuss my history, my pain level. I'll get to that later. And I learn what the other option is. So she was actually at one of those conferences where they were talking about me. And she advocated that the diagnosis of LAMN that was made at the hospital where I was operated on could be incorrect due to just a lack of training in the nuance of understanding what LAMN is versus adenocarcinoma of the appendix and goblet cell appendiceal cancer. Those are the other two options. And again, this is another doctor's opinion. Maybe another doctor might see another nuance. Luckily, there is a practice in place where when you get something extracted out of your body, these freaky little hospital people keep little microscopic samples of it on file in a jar. So my surgical oncologist has requested for the hospital where I had my surgeries at to send over samples of it so that their team, who is much more trained, can do a pathology report on these little microscopic cells under a microscope to determine if the diagnosis is LAMN, like we thought, or if it is a form of appendix cancer. If it is LAMN, the treatment that the oncologist recommended is correct. All I'd have to do is monitor. If it is one of the rare types of appendix cancer, here's what would happen. I would get the bowel resection that the appendix surgeon thought that I would have to get. And when they remove that stuff, they would take out a lymph node and they would test that lymph node to see if it's positive for cancer. I don't have the right verbiage around it because I guess it's like to see if it metastasized. To be truthful, I haven't done much research specifically on this part of the story because I am scared and I don't want to give it much more thought and attention unless I am actually diagnosed with that. But I do know that if it's positive with the language that I lack, that this is the point where I would receive a diagnosis of stage 1 to stage 4 of cancer and that I would need chemo. So in the meantime, I need to continue to get, and that would be regular chemo because the appendicitis cancer, whatever variety of it, transfers through lymph nodes like normal. It's a more regular kind of traveling cancer, not the high-pack chemo. So in the meantime, I need to continue to get a lot of blood work and monitor levels of proteins that indicate potential tumors. I have had one come back, and so far my levels are within normal limits for both of them, which is good. They are continuing to put me in front of cancer tumor review boards, conferences, case studies, which is good because it's getting attention and hyper-focus due to the rarity of it. And maybe that can also help someone in the future. And that'll help me get the best options because no matter what the pathology report shows, LAMN or otherwise, it is still very rare. And there's not a lot of research either way. When am I going to get those results? I asked for a time frame for how long it will be until I know the official diagnosis, and she said at a minimum 2 weeks, and that's if everyone is going at their best and fastest. And that was just this past Friday. So there's a lot of red tape, admin, and the cells are literally traveling by regular old mail among your bills and junk mail. After that appointment, I felt dissociated and disconnected. It was like I felt worse. I felt relieved. I feel removed. I'm kind of putting that part of what is happening on a different burner. On the stove until I have an answer. I don't want to deal with it until I know what's in Schrodinger's box. That's another reason I'm making this video because I'm tired of fucking talking about it. I really appreciate that everybody cares, but I don't want to keep talking about it. And I don't think it's good for my body to keep talking about it either. Well, that Urban Decay spray didn't work very well. So during all of this, I've also had my post-op for my original surgery. Let's not forget about that. The whole reason I started all this, the endometriosis for my OBGYN, I found out that I had, God, this wig is so itchy. I haven't worn a wig in so long, but I have not dyed my hair in so long that I like just didn't want to deal with it. I really don't care. Okay. Okay, what was I saying? The endometriosis with the OBGYN. So the endometriosis developed enough to be diagnosed as an official endo level 2. Apparently, sometimes a doctor can open you up, burn it out to remove it, and the biopsy says that it's like not enough of a level to diagnose you, which is really ridiculous. And that can also make it really difficult for insurance to give you the medicine that you need. So I'm grateful that it was like enough that it was diagnosable. My GYN was like, yeah, it's official. It was also, I mentioned that it was in a lot of areas, but it was my uterus, my vagina, my fallopian tubes, my ovaries, my bladder, literally everywhere that it could be, except my appendix because that had something else going on. Um, okay, so now I am prescribed to take a medicine called Orilissa, Orilissa, which is supposed to help with the pain as well as prevent the endo from growing back because endo does not stop. Once you burn it out, even, like it just stays, okay? Endometriosis is not something that you can do anything about or prevent. I asked if there's anything holistically I can do, diet-wise I can do, or something that I could have done to prevent it. The answer is no. It is just like kind of an immune function where when you're menstruating, you bleed outside of where you're supposed to be bleeding. And your immune system is kind of viewing blood as an enemy. So it kind of attacks it. And it's also due to an abundance of estrogen. Maybe that's why I'm so emotional. Just kidding. So Orilissa is the medicine that I'm prescribed, and it's slightly difficult to get. And there is another medicine that I forget what it's called, but there's really only like two that do this. And your doctor or your insurance might try to prescribe you that if this is where you're at in your stage of endometriosis. Do not get anything that's not Orilissa. This other medicine comes with like so many side effects. And because, like I mentioned, endometriosis is an abundance of estrogen, right? So Orilissa, the goal is to reduce your estrogen and like balance you out hormone wise. This other medicine was probably created first, and it just doesn't have all the kinks worked out. Or maybe it's made cheaply. I don't know how medicines work, but I do know that this one has a bunch of side effects, and it basically drains you of estrogen and kicks you into early menopause. So advocate for Orilissa, and also to balance out the hormones. Because it's going to be doing this, I'm also starting a specific birth control called Slind. I've tried multiple birth controls and everybody's physiology is different, but this is the one that does not give me any mood swings. And it's also specifically for progesterone, and it will help with PCOS. Okay. Pain. Healing from the surgery has been awful. The obvious, like, 5 sites of, like, I mean, even though they were laparoscopic, one of them is much worse. The appendectomy doctor, when I showed my OBGYN my incision, he was like, I told Badro that if I ever need an appendectomy, that he is doing it because he is so good, but he is not sewing me back up. Let an intern do it. Wake me up and let me do it. He doesn't get it. It's so funny. It looks like a Frankenstein-esque purple scar, and all the doctors that see it, they're like, can we check your sites? And then whenever they look at it, they're like, what is wrong with this? I'm gonna have a weird scar on that side. But anyway, for a couple of weeks, the area where the appendix was removed was like aching. And at the very beginning, I couldn't tell at all because there was just so much pain happening. But then all of a sudden, every time that I laughed or sneezed or coughed, I felt this void. It was like a hallway or something that was very empty, and it was bizarre and unsettling and very painful. And then the pain on the left side, where my original pain was, that made me schedule the endometriosis surgery in the first place, not only didn't stop, but the level of pain increased. I also learned that the reason that the pain is on the left side is just because that's where it is for most people with endo. I was so concerned about the fact that it was on the left side, even though all my issues seemed to be focused on the right side in terms of placement, like that's where the weird cyst was, and that's where my tumor for the appendix was. Like, but 65% of endo patients, their pain is localized in this exact spot on the left side of their body, of their abdomen, kind of like near where your ovary is. Very weird. Don't know, but that's just what's happened. So that made me feel a lot better. But why isn't it stopping? That's a question that I keep getting asked. Why is your pain not stopping after the surgery? I think the answer is because I still have endo. They removed a lot of it, most of it, by burning it. But my doctor told me that endo, like I said, is just forever. it's still like this like blood thing that you have. And the reason that it's still developed into this like stage 2. And Orilissa, the medicine, is going to help with the growth of it, and it's going to help with the pain. So once I start taking it, if the pain doesn't stop in like 6 weeks, we're going to look into it further. But apparently that helps with the pain and the growth. Sometimes the pain is really tough and weird though. Like I feel sometimes that my ligaments inside feel like they're trying to reform or regroup. If you've ever pulled a ligament, you might understand what that tearing feeling is like. It's almost exactly like that, but in reverse. I've also gotten these bizarre burning sensations that I can't even really put into words below my belly button. And sometimes the pain has been so bad that I've collapsed. I've been taking Matt with me on longer errands, anything longer than an hour, anything where I have to carry anything. And I'm already not strong. I'm gaining weight. I'm losing stamina because of how sedentary I need to be. The good news is that the pain where my appendix was has stopped. That's like the hollow feeling, that's gone. And the incisions are starting to heal, even kind of the Frankenstein-y one. I also just got notified, like right before I came on to record this, that Orilissa finally arrived. So I can go get that today and begin the 6-week process of starting to take that. Well, I'm going to have to take it forever, but see if it'll help with the pain. So the pain that I'm experiencing is most likely specific to endometriosis and not anything related to the LAMN or appendix issues. I just have 2 different things happening at once. In terms of how I am, I can understand how it like, okay, first of all, I'm not 100% okay. Obviously, like there's anxiety, there's fear, there's some emotions. You've seen me ticking, you've seen me crying, you've seen me resisting, right? Of course. And I also like, I think when I post things that are positive or continue to post, like there is maybe a confusion that that means that I'm okay physically as well. So I understand that it might be confusing to see that I still hosted a Halloween party and I continue to post about positive things and show up for my job and think that that means that I'm, quote, doing much better. And I need to let you know that having a positive perspective is different from having pain. And that's the same way that mental health is different than physical health, right? So being a merriment maker is my job. It has been for over 10 years and it will be until the day I die. For the past 11 years, I have talked about how important it is to be aware of your circumstances, to let them inform you about how to make your situation better, but to not dwell in them. And that we all have our own version of trauma and drama and crap to deal with. And some days it will be worse than others. And I think right now I can see that that is very true for me, right? And we can use that as an excuse to stop living. I have a very long list of reasons why I could have stopped at any given point, and I don't think anyone would have faulted me for that. And here's another one. Or we can use that as just another part of our story. We can live with it and we can live in spite of it. We can use it as another motivating factor to understand that maybe there's just something that we can help other people process, to inspire other people, or just realize, hey, there's less sand in my sand timer now. We got to make the most of what we have. I've also been advocating for the past 11 years and maybe even longer that we have one beautiful life that is temporary and fragile, and we need to be as weird with it as much as possible while we can, because we never know what's going to happen. I have been saying all of these things before cancer ever entered my world. And I believe in all of these things. And being in the middle of a diagnosis and medical crisis, or whatever we want to call this, is not a reason for me to stop living. Not me right now, not this version. Have I needed to reprioritize a few things? Have I needed to go slower? Have I needed to ask grace and patience from people and myself? Yes, 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 yes. But I'm not stopping and I will not stop. This is a time for me to walk my talk more than ever. Even if my walk is slow and I have to limp and I need to take breaks and I need to wear more sensible shoes, even though I just started wearing more complicated ones. I do not find this experience any more different theoretically than having had 10 plus mental illnesses for over 20 years and doing what I have done every day anyway. And if I hadn't shared that with you already, you wouldn't have known. So all of these things are invisible, they're rare, they're difficult to understand, but I will not let it stop me. And maybe that in itself is difficult to understand, but all I can do is what's right for me. And right now that is to keep living. And if you could party with me while I'm still here, I really appreciate it. Like I said in the last medical update video, I want to get merriment making trending. And anything you can do to help with that, liking, sharing, commenting, not this video necessarily, but like my actual work. Not because I might have cancer, but because it's important and we all deserve to love ourselves and have a fun life. I think that's pretty fucking cool. Okay, that's it. That's my update. And when I find out the diagnosis, which is either going to be, I mean, no one wants to have to monitor themselves every year for the rest of their life. But I will take that. We want LAMN for me. That's the best of these two evils. We do not want the other option. Okay. So that's what we're praying for. That's what we're crossing our fingers for. That's what we're wishing at 11/11 for. That's what we are doing, whatever it is that you do for. Okay. And thank you for listening. Thank you for caring. And thank you for supporting and loving and being a merriment maker yourself. Go for you in this story. Keep walking your own talk. And if you notice that there's a place in your life where you have been using something as a reason to not live as large as you can, start living big again. I believe in you. I believe in all of us. Okay.